The following is paid for by Advanced Physical Medicine of Miami.
The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
Welcome to Healthy Dose Radio. I'm your host, Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami. You can find out more about us by visiting our website, apmrmiami.com, and by following us on Facebook and Instagram at apmrmiami. We're back today with Roger Torres, great friend of ours, great friend of the office, and also with Rob Sapero, our office manager. And we're following up with last week's show where we spoke to Roger about his recovery utilizing biologic allografts that contain mesenchymal stem cells to really allow his body to recover from a catastrophic shoulder injury that was in need of shoulder replacement. How you doing today, Rob?
I'm doing excellent. Oh, Rob, I'm sorry. I thought you said Raj.
No, Rob and Raj, two of my favorite people.
Sounds alike. No, I'm doing good as always.
But, some more time has passed. We had a training session together.
Yes, we did.
And we did pretty well.
Yeah, a little introductory. Get ready for tomorrow.
Yeah, I can't wait. Kind of a recovery for both of us, too. I don't know if I've mentioned to the audience before. In late November, I had a pretty catastrophic injury myself where I tore my pec working out. Was really in some of the best shape of my life. Felt great, no symptoms. Bench pressing one night after work, and all of a sudden it snapped like a rubber band. And
I believe even the day before that day, you're like, man, I haven't felt this good in a long time.
Yeah,
you're at top of your game.
It just goes out to show that feeling one way is never an indicator of what your true health is. It's always important to get evaluated, to get checked, especially when you're talking about the musculoskeletal system. The skeletal system is the one that really lets us down and fails us over time, that we have almost no control over personally. Muscle-wise, you could look in the mirror. If you have one arm that's smaller than the other, you can add curls, hammer curls, and bring it up to match the other side. But if you have physical pain that's causing lower back pain, shoulder pain, neck pain, and lower back pain, how do you know what the cause of that is unless you can physically see it? And having an x-ray allows us to do those things. But that being said, I was having no pain, bench pressing, and all of a sudden my shoulder and pec just gave way. Completely tore, completely ruptured, and set me up to have a surgery a week later. I went in for the surgery, came out, went home for a week. I was under for about 4 hours, and I remember something just didn't feel right. And coming back from a week's vacation, was rushed right back into the hospital for emergency surgery because of septicemia. It was a blood infection that was actually introduced during the surgical procedure and knocked me off my feet. I was hospitalized for the better part of a week, actually over a week, round-the-clock IV antibiotic therapy, lost 20 pounds, and really didn't know if I was going to be able to come out of this. Had 2 more surgeries. They couldn't identify what kind of bacteria it was, if it was MRSA, if it was staph. And finally, because of some really good doctors, they were able to identify what it was, and thankfully it wasn't either of those. But I came out of this really passionate to talk to our patients about the necessity of avoiding surgery for physical conditions and making it the last choice. because the risks of surgery are greater than the risks of infection are greater than you think. And it almost stopped me completely from permanently doing the things that I like to do, which is working out and adjusting and being with our patients. And I think that's why we clicked so much, Roger, because I felt what you were feeling. And, I was coming from a place where it meant something personally to me to make sure that you got the full recovery that you really deserved. And, it's pretty interesting of where we are sitting here today, getting ready to go on a journey together. Yes, and build these bodies back, right? Yeah, I'm looking forward to it. I mean, again, as I mentioned earlier, it's to me, it's still mind-boggling that 13 weeks I'm at where I'm at, and be able to get back in the gym and start training, and no better experiences than start doing it with the people that I do it with, and doing something that I love. And one of the things that we spoke about was when people undergo this regenerative procedure, one of the things that can happen is they feel too good too soon. And they want to get back in there and go full throttle back to 100% because the pain is gone. They could sleep without, waking up 4, 5, 6 times during the night. You get back into the gym, 2 workouts later, you're ready to throw weights around like you did before the injury. And we had an experience with that, right? Yes, we did. We worked out the other day, and again, I'm glad you were there because you would have known what, I'm sure what I would have been right back in your office. And again, it's because of my history, my past. Again, when I do something, I do it 110%. I'm relentless about it. And certainly, I feel so good. I feel so good. Again, 13 weeks after stem cell, I've been ready to go. Yeah. And as you saw it, we were working out together along with our friend Danny, and I went from 20s all the way to 60, and I was ready to go, and it was not an issue. But with a little bit of guidance under you, I was able to, rest my mind and my ego a little bit and do things the right way. And again, I feel great, ready to go back at it tomorrow. And that's definitely the hardest thing when I talk to patients is, when can I get back to doing the things I love? I want to do it. They're so anxious, but they just have to sit on their hands sometimes and let the body just heal. Yeah. It's almost counterproductive to try to go out there and do all these activities and just continue to damage a joint that you're trying to rebuild. Yeah, certainly. I'm sure if I would have never have met you, Dr. Joe, and your incredible staff, by the way, I just want to say thank you for your staff as well. Top-notch staff. I've been, obviously within my career, what I do for a living and all that, I've been around many hospitals and many facilities, doctors' offices, and I want to say thank you because it starts at the top and it trickles down, and everybody has been exceptional and has been part of my recovery. But what I wanted to add to what Rob is saying, no, please, words cannot express enough gratitude. But what I wanted to add, what Rob was saying was that, I'm sure if I would have had a shoulder replacement, I would still have aches and pains and this and that, and I wouldn't be 100%. But with the stem cell, I feel like nothing ever happened. So it's pretty amazing in that these cells already exist in your body. We've all undergone to an extent some sort of stem cell therapy with any physical injury that we've had, whether we are 5 years old or whether we're 95 years old. It's just that the cells become weaker as we age. All of us here don't have as much hair as we did 15, 20 years ago. We don't look the same way that we did. Some of us look better. Roger, I think you probably look better than you did 20 years ago. But everybody changes. You can't stop the chronological clock or the clock that ages us by the numbers, but the biological clock, the endocrine clock, how we age internally, you have a pretty good control over that, whether it's by clean eating, healthy diet, replacing some of these key vitamins, hormones bioidentically, safely, and getting your body to utilize these stem cells efficiently over time, you're able to start healing and doing the things you like to do again. A lot of patients feel very, very helpless. And I think the worst thing to do is to wait. Patients say, with 21 years of practice and the hundreds of thousands of patient visits I've seen over the years, they say, what's the best advice that you can give to a patient who has physical pain? And it's don't wait. Don't wait. Right. Prevention is the best medicine. Yep, 100%. And in your line, you're the top responder for these pretty devastating, catastrophic injuries. You're on flight rescue, and what is the most important thing in terms of getting these people not only saving their lives but getting them back to full quality? It's time. Right, 100%. It's something we call the golden hour. Get them to that trauma center facility within the hour, 60 minutes. And that goes for heart attacks, strokes, and all that. So absolutely, it's time. And that's the difference between life and death in a field like yours.
Absolutely.
And for us, and it's not life and death, but it's function and quality. Right. The sooner that you can work on a patient, there's two things that come to mind. Number one is the cost is less the sooner you treat an injury.
Correct. And
the recovery is going to be better the faster you can treat an injury.
100%.
You always use a great example, which is a car light. You know, when something pops up on your car, hey, low oil or the tire pressure's down, you fix it right away. But with your body, you don't get those signals so fast. By the time you get that signal, it's already too late. You know, so that's something that you got to just be very in tune with your body. So, like you said, you got to do something, and you got to do it sooner than later.
With physical symptoms that produce pain in joints, whether it's neck, lower back, always get it checked. Always get it checked. If it's something that's going to heal by itself, you need to find out if that's the case. If it's something that is degenerative, there are amazing techniques out there that we utilize in the office that are amazing for acute, brand new conditions, for chronic conditions that become flared over time, whether it's chiropractic, physical therapy, massage therapy, athletic training, using Graston technique, all these amazing tools, cupping that we have at our disposal in our office. But if the condition is degenerative, there's two issues that you have. You have the pain and then you have the degeneration. Those tools that I just mentioned for a degenerative condition are absolutely 1,000% better than taking any drug.
Absolutely.
Because you are eliminating or lessening the pain, but what are you doing for the degeneration? You have to fix both things, at least to the best of your ability. So to address an issue like pain with a natural practice that can get the body back on track to reduce the inflammation, but also to fix a condition that produces degeneration that secondarily produces the pain. That's the end-all be-all. And in an office like ours, that's a physical medicine office. We do all of those things. I think there are people out there that have never heard of physical medicine, right, and they think that physical medicine is just another doctor's office that prescribes pain meds, anti-inflammatories, and muscle relaxers, and we're the farthest thing from that. In fact, I don't know the exact number, Rob, but I think we saw over 20,000 patient visits last year, and we didn't prescribe one anti-inflammatory, one opioid, or one muscle relaxer. That's something that I'm most proud of.
Yep. Oh, I can vouch for that.
And it's not always easy, though. You know, with physical medicine, as we mentioned earlier, the origin of your problem was physical. There was a problem in the neck. Yeah. There are 7 bones that move in the neck, the nerves that come out of the neck. 100% control the function of your traps, your levators, your rhomboids, your deltoids, your biceps, everything from the upper extremity. In fact, they're so sensitive that if you damage the spinal cord in the cervical spine, you lose function to the rest of the body.
Wow.
So we're talking about injuries that don't sever or permanently compress nerves, but a little bit of an irritation on a nerve can cause a permanent, significant muscle weakness and or deficit unless it is corrected. Right. And little by little, that's what we started working on, and kind of where we are on our journey together now. It's more physical in terms of realigning the neck, upper back, right, than it is deterioration or fixing damage inside the shoulder.
Yeah, it's like you mentioned to me a few weeks ago. We're like, okay, once I had the results that I had already gotten from the stem cell, you're like, okay, Raj, we need to start now. That's when you had dissected. It said, we need to figure out how you got here. And it was just that planning of you saying we need to start working backwards. Yeah. Which is actually why I'm here now today and back in the gym.
Yeah. Reverse engineer the injury.
Yeah. We got to the base of the problem.
Yep.
So took care of the major problem.
Yep.
Getting my life back really, and to be able to live a normal life now, all the way back to okay, let's address what the base of the problem was, and now
going from here, the most important thing is to keep you well and to prevent this from happening again. The recovery that you've had, the cells, the tissues, they're your own now. So that tissue that is cushioning the glenohumeral joint or your shoulder joint, those muscles, they're your own muscles. There's no tendon graft in there. Your body has fully recovered on its own. Right. And the most important thing, as I mentioned, is to make this long lasting. And for people our age, I'm 48, you're 45.
Correct.
The most challenging thing to do is how do we keep these anti-inflammatory hormones in our body high enough to enable us to carry on this recovery for the rest of our lives? And the simple answer is we got to really work on that, because it's not something that we can eat our way out of. We can't meditate our way out of this. We actually have to do something to address some of these key hormone levels that have started to drop as we age. And that's partly some of the reasons that the injuries have occurred over time. You have depletion in stem cells, and you also have depletion in key hormones that aid the body in terms of its ability to recover and repair itself, specifically testosterone and growth hormone. And do you have any experience, Roger, with looking at your testosterone levels to see if they were high or low? Or
I have checked them in the past, that's something I was waiting. To be honest, I was waiting to go ahead and recover from my stem cell therapy, and that's something that I'm going to be looking into now further, because at my age of 45, I did have them not that long ago, and they weren't low, but they were, it was just normal on the low side. But that is definitely a big interest of mine that I'm going to be doing probably.
And it's so important,
shortly.
So important what you just said, that they're normal, but they're on the low side.
Correct.
And we spoke, I think, on our last episode about the difference between normal and optimal when it comes to evaluating these key anti-inflammatory hormones in the body. And testosterone is a hormone that, when optimal, significantly reduces inflammation in the body, significantly aids in the body's ability to repair itself from these types of injuries that affect tendons and ligaments. And being normal does not mean that you are able to recover or heal. Being optimal means that you are. And to state a range, again, in speaking about men, the normal testosterone levels range anywhere between 250 to 350 on the low end and 900 to 1100 on the high end. And if you come in as a 45-year-old with a testosterone level of 350, guess what you're called? Normal.
Right.
But your body's ability to recover and repair itself is anything but normal. Getting yourself up to the levels of 700, 800, 900 really gets your body on track to reduce some of the inflammation that is producing pain and preventing these injuries from healing.
Yeah. This is something that I was looking into, and that's that you brought it up. I'm gonna that's something that I wanted to speak to you about later on. Obviously, in the office, was go ahead and getting on your program for TRT, or testosterone replacement therapy. Yeah,
we have one of the largest practices down here in bioidenticals, and bioidentical supplementation is very, very different than testosterone replacement therapy. Bioidentical utilizes several different hormones and vitamins to bring your levels up to optimal. Testosterone replacement therapy utilizes one.
Okay.
And testosterone replacement is simply going to a doctor, getting a prescription for testosterone, getting it covered by your insurance, and them saying, I'll see you next year for a refill. And what happens with that, more often than not, when those patients come into our office, they're the most difficult to fix. We'll find them with elevated hemoglobin hematocrit levels, secondary elevated blood pressure or hypertension, and then further on down the line, we'll begin to see some sluggishness of the kidneys, because all of that volume of blood and fluid moving through the system is taxing on the kidneys.
Elevated sugar levels as well.
Elevated sugar levels. And so with bioidentical, before we are prescribing any type of hormone or vitamin, we're doing a complete blood analysis where we look at CBC with differential, which is a complete blood count with differential. We look at a metabolic panel. We assess the functioning of your kidneys, your liver, your cholesterol levels. We look at vitamin levels like B12 and vitamin D. We look at IGF-1, which is a measurement of growth hormone in your body. We look at, obviously, your sugar levels, hemoglobin A1C. And for women, we look at DHEA sulfate, progesterone, estrogen, as we do in men as well, free and total. And only after looking at all of those factors are we able to put together a program to find out how to fix or correct these deficiencies. And oftentimes when patients get these levels corrected and moving from normal or out of range into the optimal range, it is life-changing. Life-changing not only in terms of how you feel overall, but your performance in the gym, your performance at work, your drive, your ability to recover from injuries is very similar to the way it was when you were 18 to 25 years old. So when you couple that with regenerative medicine, I mean, that's pretty much the holy grail of what we do in the office. And, as far as bringing Roger back into it, he has had a recovery that is unique. It is a testament to him because he listened to what we said and to what we prescribed. As I mentioned earlier, doing too much too soon will take any good result and basically flush it down the drain.
Yeah.
So you have to be compliant, right? Rob, that's what you see on the
over
back
the
end
years,
as well?
what we found is less is actually more. It's just letting your body just do what it needs to do. Your body knows how to heal itself. If you cut your arm, unless it's a huge gash, you don't need stitches. Your body knows how to repair itself. If you catch a cold, your body can recover from that. So all we're doing is providing the materials, providing the nutrients, the vitamins, the hormone levels, raising those up to get your body to do what it should be able to do naturally.
And so you're going to get back to free diving again?
Nice.
Yeah, actually, I've never left it. Competitive freediving, possibly, but I still am an avid freediver and spear fisherman. So,
and for those of us, like I was one of those that free diving just means going down without a snorkel. Free diving. Why don't you tell everyone what that is?
Yeah, well, it's free diving. It's where you go ahead and you're in the ocean and on one breath of air you dive as deep as you can. So that's what competitive freediving is. I mean, there's different.
How deep have you ever gone?
Well, believe it or not, I was 310 pounds, and at the time back then, and I dove. Pretty quickly. I was not getting ready for competition at 306 pounds. I just never left freediving. But even when I was obese at 306 pounds, I still dove 110 feet on one breath of air, which is so. But I'm professionally trained. I took freediving classes with a gentleman up in Fort Lauderdale, who's well known in the freediving community. So and that's how I got there, and it's been great. It's been great. But now looking to possibly getting to some competitive bodybuilding. We'll see.
Absolutely. I mean, when you came up here today, I'm used to seeing you in the office with workout shorts and basically your shirt off, working on you and adjusting and scraping, doing some Graston, just all the fun stuff now. Now we get to do the fun things because the injury is just about healed, and we're working on you just like we would our other patients that come in when we take an x-ray and they're having some neck pain, lower back pain, and their conditions are not degenerative. Which is really an amazing thing and a testament again to you following through with the care and getting the results that we absolutely expected and hoped for.
Yeah, I got to tell you, it was I think also that aided, and I think that what aided so much in my recovery so fast as well, and to seeing the results that I did also see is I followed everything to the T. Yeah, and I mean literally to the T. So everything you and your staff told me to do, I did. What not to do, I didn't do up until today. Yeah. As you know.
It's such a different process than regular medicine where you take medication, you do a cortisone shot, you feel great relief right away, but as time goes on, it comes back. And with stem cells, you're not going to get the overnight relief you happen to do because you responded great with the prolozone, shockwave, and high-power laser. But the real magic is just starting to kick in. And with that, it's only going to build up every month. It's going to get better and better. Month 6 will be better than month 4. A year from now, you'll be better than you were sitting today. So definitely something to look forward to.
Looking forward to it. It's hard to believe I'm going to be even better than when I feel right now, but looking forward to it. I feel great. Thanks to you guys.
Yeah, anytime.
Yeah.
So, Roger, I want to thank you for coming in here today, being an amazing patient, being an amazing friend, and sharing your recovery with everyone out there, because I know your story is going to help even one person out there make a decision to change their lives just like it has yours.
Absolutely. I totally, who's ever considering a shoulder replacement, hip, knee, look, I highly recommend it. Look into this, and I promise you'll never look back.
Yeah, if you're in pain is not normal. That's the first thing you need to understand. There's no such thing as normal pain. Pain is a problem that you need to address. And if you need to find out more information, you can visit us at our website, apmrmiami.com. You can call us 305-598-8788, make a consultation, sit down with Dr. Joe so he can go ahead and evaluate you and see what we can do to help you.
And stay tuned for future episodes where you will learn more about the different ways to repair your body naturally, on how to replace key hormones, vitamins, and stem cells safely and effectively, and how to allow your body to regenerate and heal itself without the use of drugs and unnecessary surgery. Remember, repair, replace, and regenerate. I'm your healthy host, Dr. Joe Gambardella, and I'll see you next time.
Repair your body. Replace your key hormone levels. Allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788. 598-8788. 598-8788. 598